At-home diagnostics and care. It's been gaining popularity for several reasons, as they offer numerous advantages to individuals seeking convenience, accessibility, and cost-effectiveness. Here are 10 key benefits of at-home diagnostics and care. Convenience. At-home diagnostics and care provide individuals with the convenience of accessing medical services from the comfort of their own homes. It eliminates the need for scheduling appointments, traveling to healthcare facilities, and waiting in crowded waiting rooms. Accessibility. At-home diagnostics and care break down geographical barriers and improve access to healthcare services, especially for individuals residing in remote areas, where healthcare facilities may be limited. It enables people to receive medical attention and monitor their health without the need for physical proximity to healthcare providers. Time saving. By eliminating the need for commuting and waiting, at-home diagnostics and care save individuals significant amounts of time. It allows people to invest that time in other important activities, such as work, education, or spending quality time with family. Cost-effectiveness. At-home diagnostics and care can be cost-effective compared to traditional healthcare settings. It eliminates transportation costs, reduces the need for multiple visits to healthcare facilities, and lowers the overall healthcare expenses associated with in-person consultations. Personalized care. At-home diagnostics and care enable personalized healthcare solutions tailored to individual needs. Remote monitoring devices and applications allow healthcare providers to collect real-time data, facilitating personalized treatment plans and interventions. Enhanced patient engagement. At-home diagnostics and care empower patients to actively participate in their healthcare journey. With access to personal health data, individuals can better understand their conditions, make informed decisions, and engage in proactive self-care. Early detection and prevention. At-home diagnostics facilitate early detection and prevention of health conditions. Regular monitoring and timely analysis of health data enable healthcare providers to identify potential issues, implement preventive measures, and intervene before conditions worsen. Continuous monitoring. At-home diagnostics and care enable continuous monitoring of health parameters. This is particularly beneficial for individuals with chronic conditions or those recovering from medical procedures. Remote monitoring devices can track vital signs, medication adherence, and other relevant metrics, allowing healthcare providers to intervene promptly if necessary. Reduced infection risk. At-home diagnostics and care reduce the risk of infection transmission, particularly during contagious disease outbreaks. By avoiding crowded healthcare settings, individuals can minimize their exposure to pathogens and reduce the likelihood of contracting or spreading infections. Empowerment and autonomy. At-home diagnostics and care empower individuals to take control of their health. It fosters a sense of autonomy, allowing people to actively manage their conditions, engage in preventive measures, and make informed decisions regarding their well-being. In conclusion, the popularity of at-home diagnostics and care stems from their ability to provide convenience, accessibility, cost-effectiveness, personalized care, enhanced patient engagement, early detection, continuous monitoring, reduced infection risk, and empowerment. These advantages contribute to improved healthcare outcomes and a more patient-centric approach to healthcare delivery. For more information, make any comment to Dr. Healthy Living in the description. Thank you.